Yes, my name is Dhananjit. Now we are making a video for activity 2A, unit 047, and his name is Hiten Gupta, but he is playing a role as a Jordan supervisor. Hi Jordan, thanks for meeting me with today. I have identified two challenges I have been facing during my placement, one related to duty of care and the other concerning ethical practice. I was hoping we could talk through them and explore some strategies together.
Of course, Dhawan. Let's go through each one of them and see how I can support you.
The first challenge is about duty of care. Last week I noticed a client was left unsupervised in the hydrotherapy food area for a few minutes while staff were transitioning between sessions, and I was not sure if I should intervene or wait for the supervising physiotherapist. The challenge for me was not knowing if stepping in would be overstepping for my role boundaries, but at the same time I feel responsibility for the client's safety.
It's a very challenging situation. It's great that you were thinking about both safety and the scope of practice. What concerns came up for you during that situation?
My main concern was that if something had happened, I would have felt responsible even though I didn't cause. But I also didn't want to act beyond what I have allowed to do as an assistant.
That's a fair concern. One strategy could be to clarify escalation procedures. For example, in moments like that, you can alert the nearest staff member or call for help immediately while staying near the client to observe. You're not performing the treatment, just ensuring safety. We can also review the supervision protocols with the hydrotherapy team.
That would be really helpful. I think I need a clear understanding of my responsibilities in those kind of situations. The second challenge involves ethical practice. I overheard two staff members casually discussing a client condition in the staff kitchen using the client's name, and I felt uncomfortable because it didn't seem private or professional.
It's an important observation, Daman. Why did they feel like a challenge for you?
I was unsure whether I should speak up or report it. I didn't want to create tension with the team or seem like I was accusing someone. But I also didn't want to ignore what felt like a breach of confidentiality.
There's a common dilemma in healthcare. Ethical practice often includes standing up for the client rights. Even in the awkward situation, in this case, it's appropriate to report your concern to a supervisor. Discreetly and professionally. You did the right thing by bringing it up now. Would it help if we reviewed the confidential policy together?
Yes, that would really help, and maybe some strategies for how to approach a situation like that it happens again.
Absolutely. We can also look at some scenarios in the next supervision session to build your confidence around that.
Thanks for listening and helping me work together through. I feel more confident now, especially about knowing where to draw the line and when to speak up.
You are doing really well, Daman. These are exactly the kinds of reflection we want to see. Let's follow up next week to check on how things are going and go through the policies together.
Sounds good. I will prepare a few questions and notes before our next meeting. Thanks again.
Yeah, thank you.
Thank you.